Yes, you can start.
So, good evening, everybody. I'm welcoming all to our today evening's program. Surendra sir, I request you to take the class forward. Surendra sir.
Good afternoon, everybody. Good afternoon. I think the climate is slowly turning towards winter,
Yeah, going to monsoons.
and it's a pleasant day in Chennai. We're all happy. All right. See, last 3 to 4 classes, I've been telling about the psoriasis, psychosis, syphilis, and particularly chronic and acute cases. Now, today, I want to just take a different subject, the pain management. What is pain management? There are two aspects. One, you have to palliate the pain, simultaneously see that the pain is totally removed from the body. Do you mean to say you can take a hammer and put it on the affected part and it will be over? No, it is a delicate body. It has to be delicately handled. Delicately handled. That is where the human ingenuity as well as the evolution of the medication and the treatment comes in. In the olden days, there were, along with allopathy and other systems, there was a method of applying the therapy, physiotherapy. Now it is now part and parcel of allopathic system. In every hospital, they bring this physiotherapist, whether it is cramps, whether it is fracture, or any other matter, paralysis, etc., etc. They bring in this physiotherapist. Siddha Ayurveda also undertakes it. But I don't understand why the homeopathic physicians or association have not adopted this simultaneously in the pain management. No doubt we are confident on our medicines that well selected remedies, whether it is acute or chronic case, slowly it will eliminate the morbidity as well as the affected region, including the pain, thereby the patient is relieved of his sufferings. But it takes time. This is a fastest world. We are now living in a very fastest world. We have to run to maintain our stability. Everybody say they run in the America to catch their position, or at least to maintain their position, if not going up. So that is the order of the day. But why homeopathy is not adopting this physiotherapy? See, I am not accusing. I am not belittling the homeopathic system of treatment. But if it can be applied, why should not be applied? We are not taking any external medicines to the affected part, affected organs. Yes, there are many methods of the therapies, physiotherapies. But the system is that they will apply them smoothly, not roughly. You know one thing, in the oil therapy, I have already told you, when the therapist makes the body muscles massage and other things, he is reducing the heat of the body, no doubt. But in the exercise, the therapist also is giving his heat to the our body. That is vice versa that takes place. But we have to overcome all these problems. Sir, why this then? Why should I go? No, we have to undergo this ordinance. Like that. Therapy also must form part of homeopathy for a speedy and efficacious results. Yes, there are many sudden pains. I'll just explain to you and give some few homeopathic remedies. Pain in the eyes. We have been repeatedly telling, Ruta comes first by constant reading, that was olden days. Now constant viewing, computer, application, seeing the mobiles, seeing the watching the TVs. So Ruta is the best medicine. When the pain on the left side shoots into the left eyeball, you can think of Pygelia, because Lia, Pygelia is the last three words, Lia, that means left. You must understand that things like that. Pygelia means left. Lia means left. That is left side affections create problems into the body. Pygelia. Same way, Ria, sanguinary Ria, right side. You remember this. If things are affecting on the right side, from right side it goes to the body, sanguinary Ria already. Due to bloodshot in the eyes or redness of the eyes, belladonna, from right eyeball, I already said sanguinary. When pain in both sides are there, nectar more, all related to eye and eyeball. Pain after pain in the eyes after coitus, syndrome. This is for young couples. Onospodium, feeling tension in the eye, etc. So some 5 to 6 drugs suddenly comes in for any onset, and you also know when the redness is there in the eyes, if the Madras eye creeps in, you know Euphorium perfoliatum drops to be put on the eyelids. It will avoid spreading to the family members. Of course, we take protective glasses, no doubt, but it will not spread. It will not become contagious.
சொல்லுங்கம்மா.
Next thing that your treatment affected is tooth.
அம்மா கிளாஸில் இருக்கானே இப்போ தெரியலையே வந்திருக்குமே எல்லாரும் வந்தாங்க.
Toothache due to decayed or broken teeth, lower jaw, particularly in the old age, as well as in the case of persons who smokes or who chew tobacco. Aram tribunum, 200 potency should be given, because the tobacco has to be tackled with higher, toxic things has to be tackled with higher. When pain is relieved by the sweets, toothache is relieved by sweets. Chenopodium. When pain is due to the sweets, argentum nitricum. See what a homeopathic beautifully tackled. Kapya cruda, when cold ice water you take and you are getting pain in the teeth, kapya cruda. Phosphorus, due to frequent usage of hands in the water, dripping water. There are very good medicines like merserium and creosotum in homeopathy. And the head remedy is Plantago major. This is a beautiful medicine. You can take Plantago major on the toothache by applying the tincture through cotton bed on the teeth. You can take these drops also simultaneously into the stomach. It gives you relief. Along with that, if you take hypericum, it's better. If tooth decay and other things are there, they say root canal has to be done. You have to spend 5,000, 7,000, something like that. Within 200 to 300, you can overcome that. Added to that, you take simpleton pills. It will try to establish the enamels on the tooth. Slowly. That is how beautifully homeopathy works. Yes. There are other medicines. Let us not worry about. These are all the emergency medicine. Even when my chamber advocate telephoned to me yesterday, sir, I am getting pain in the tooth. When I visited the dentist, he said the root canal has to be done. So immediately I thought of you, I telephoned to you, please suggest me the medicine. I have given by the ops, saying that Plantago tincture major, both application on the teeth as well as in, and hypericum and merserium, because root canal is affected. Hypericum tries to help. Merserium tries to remove the morbidity surrounding the teeth. Merserium. That's how homeopathy would. Probably that is why the homeopathy doesn't want to go for physiotherapy. No, I don't accept this present conditions. Present conditions, I don't accept it. Your medicine may be most effective. It may go in and churn and bring the morbidity outright. Thereby, vital force is rejuvenated and you become normal. Still, I tell you a striking example. When my wife was broken her bones, she was admitted in the SIMS hospital. They put 3 to 5 screws, rod and etc. She was not able to walk for 3 to 4 months. She was in the bed. Slowly, but in the hospital, the surgeon has advised the physiotherapist not to insist the patient to walk freely and quickly. Don't insist it, because physiotherapists used to insist. They want to give us boost. So what happened? She became lazy. So I have particularly called for the physiotherapy, massage her muscles. This is mostly prevalent in Ayurveda system. In Kerala, anywhere you go, the physiotherapists are there present because they release. This is an additional relief given to the patient. That's why I'm time and again insisting. Of course, I will tell you again when I come to these bones problems. Pain in the chest suddenly comes in. arnica generally so feeling. But we don't come to the patient doesn't come to us at this stage. He won't come to us at this stage. Ranunculus bulbosus is for intercostal rheumatism, sharp stitching pains, etc. etc. Rustox is also helps. Seniga, cold stitches in the muscles of the feet. Sir, how do I know? The patient says, I feel cold feeling. Because this understanding of the homeopathic symptoms by an ordinary man is very difficult. That is why we suggest simply arnica, rustox, bryonia, etc., etc., etc. Then comes the other problems like inflammation of rectum. See, after the small intestine and larger intestine, where there's sense organs are little less when compared to the body tissues, unless very heavy pain or very heavy ulceration by way of dysentery and other things are there, you cannot understand the pain in the rectum, etc., etc. So, contractive pain, shooting and smarting pains at the rectum. Ignatia. Ignatia also comes in for prolapse of the rectum. Then capsicum. When there is a tenesmus in the rectum. What is tenesmus? That is fibroid conditions or some constrictions there. So capsicum comes in. Shooting pains. Phosphorus. In cases of acute conditions, allose podophyllum comes in. When there is offensive discharge along with pain, acid nitric comes in. This is the simple pain management in the rectum. Then we go to the main thing where nervous system, rheumatism, gout, arthritis comes in. Here I insist time and again, along with our treatment, the physiotherapeutic activities must go on. No doubt they are also becoming faster. Housing visit will be 300 to 500 rupees per day, all those things. But homeopathy, room massage is there. Now that massage by SPL, they have now prepared internal liquid also. The other day, the supplier has given me physician sample, room massage, internal liquid, like that ortho herb, ortho liquid like that, no? You see in the TVs and other things, internal liquid as well as external application as well as internal tablets. Like that, homeopathy also, they give room massage application as well as a liquid. I have not tried it. I have given to one patient, even though it is a physician sample, I wanted to test it, etc., etc. Excellent remedy for aggravated or plain pain, aggravated by motion, bryonia. Movement aggravation, bryonia. Rest aggravation, rustox. Rustox, bryonia you give. Is that over? The affected parts must be made this physiotherapy by oil massage or coconut oil. You don't have anything. The coconut oil is the best healing oil available in the world. So, like that we must understand Of course, I will take about this because last week itself I have taken much of the time, depriving the time for my colleague Suresh. So I will take this next class. Okay, thank you, thank you, thank you.
Yeah, thank you, sir. I have one clarification, Suren sir. For the madrasa, you said something, no? You said Eupatoria perf has to be dropped.
Chat.
It is
For the
euphrasia.
for the
It is euphrasia.
euphrasia. So that's
Euphrasia.
just Eupatoria perf is not the right medicine.
Drips should be applied.
Yes,
So
yes.
for the-
Eupatorium perf you have told, sir.
Yeah, euphrasia has to be used.
Euphrasia.
Oh, yeah.
Euphrasia.
Yeah.
Sorry.
Yeah, thank you, sir. Thank you, sir. So, Murthy sir, you can take. Suresh has not come, sir. Suresh
Yes.
sir has not come yet.
Not come?
Not yet come, so Murthy sir can take.
So you can.
Yeah.
So is my voice audible?
Yes, sir.
Namaste, my dear homeopaths. Last week we have taken prostatitis. Simple revision. Prostatitis is nothing but inflammation of the prostate gland. Causation, bacterial infection or gonorrhea or because of aging. Symptoms, retention of urine or stagnation of urine in the bladder, and the stagnation causes cystitis, that is inflammation of urinary bladder. Urine passes slowly and there will be frequent urging also will be their symptoms. It causes fever and shivering. Sometimes it causes cancerous tumor also. So that is the last stage, not now. Treatment, the first and fundamental is when the hypertrophy, that is unnatural enlargement of organ, that is prostate organ, Chimaphila umbellata. For this, frequent urination and discomfort will be there. Chimaphila umbellata. Next is spongia. Useful in prostate along with spermatic cord. When spermatic cord is also somewhat painful and uneasy, then we will give spongia. Spongia will work along with Aramet. It will work on the testis, spermatic cord, and pain back for that. Next, ferrum pick. It is very useful for prostate enlargement and inflammation of gland. You have to take the ferrum pick in 3x or 6x potency to strengthen the prostate gland. The best medicine for prostate gland is Sabal cerulata. It may be taken in mother tincture. Sometimes we can give in potency also. Useful in the both inflammation and enlargement of the prostate gland. Sometimes that area will be hot and swelling will also be there. And it is one of the best remedy along with conium and beritacar for aged people. The persons who have crossed 60-65 years, those people, beritacar, conium, whichever you want to select, along with that Sabal cerulata will be good. Previously also when I told some therapeutic classes for prostatitis in the old age, we are having what are the medicines? Anybody remembers? One is beritacar, second one is conium, third one is Sabal cerulata, fourth one is Sarsaparilla, Lycopodium, Equisetum. These are the medicines whenever you are having prostatic problem is there. So you must be remember beritacar, conium, Sabal cerulata, Sarsaparilla, Lycopodium, Equisetum. Whenever any disease comes, means what are the medicines available in homeopathy? Minimum 5 to 6 it must be remembered to you. Then as per symptom wise you have to select. Next, digitalis, enlargement of prostate gland along with the heart trouble. Because so many people above 60, heart trouble will be there. For them, digital is also one of the best remedy. Tuja, when discharge is greenish or yellowish, then we have to give tuja. Equisetum, frequent urination or urine by drop at that time we will give. So this is what we have taken in the last class. Now I want to take only one thing, renal calculi. I think previously Anup Kumar also has taken this chapter and so many people have covered this one. I think all are masters, but the preliminary I will tell. It is otherwise called as nephrolithiasis, that is condition where stones form in the kidney. Renal calculi, that is the stones, are commonly composed of calcium, oxalate, or phosphates, or both. Phosphate stones tend to develop when infection is present. Uric or ureters cystitic stones are less common. Certain specific factors are known to play a role in the stone formation, such as hyperthyroidism, congenital cystinuria, gout, and infection of the urinary tract. One thing, morning walking is the most important, early morning walking, and second one is plenty of water intake is the most important. These two we should not, in the young age itself, we have to cultivate. Proper movement of the lower extremities is the most important. Even nowadays, previously, because of our job, we are sitting in the office under the fan or under AC, we are getting. But young age also, they are getting these renal problems because they are sitting with the computer or laptop or cell phone or whatever it may be, hours together from morning to night, even taking food also by seeing cell phone only. This is the fashion of the day. So we have to tell them, in future you have to face these type of troubles. Better to be like this. Calculi can be divided into primary calculi and secondary calculi. The primary calculi occurs in high concentration of chemicals in the urine or defective mechanism for keeping these crystallism in the soluble form. There are three types of primary calculis. One is urate stones, consist of uric acid and are common in gouty patients. Number 2, calcium oxalate stones, which cause hematuria by damaging the mucosa. Third one is mixed calcium oxalates and phosphate stones. This type of stones occur in hypercalcemia, that is accompanied by hyperparathyroidism and prolonged period of recumbency. Secondary calculi is sometimes it is because of the secondary infections. These stones are composed of calcium oxalates and phosphates. It is only theoretical, it will not work for us. Only pathological report, by seeing pathological report, what type of stones he is having, what type of diseases he is having. See, rheumatoid arthritis or gouty arthritis, whatever it may be, to bring to a conclusion, this type of thing is most important. In pathological report, you will see all these things. Symptoms of renal calculi is ulceration, obstruction, hemorrhage. These are the while urinating. While urinating, you will have a burning sensation, obstruction, and hemorrhage. Second one, stones in the kidney may cause pain in the loins, and it creates infection in the uretic structure. The treatment is to reduce this thing. Belladonna and chamomilla is the most important. Immediately to reduce the pain. Only reduce the pain and inflammation, belladonna and chamomilla. If the person is very fearful and anxiety because of the pain, you can add aconite, belladonna, chamomilla. Next medicine is lycopodium, colicky pain in the right side of the abdomen, which extends to the bladder and frequent urging to urinate. The urine has red sediments. Lycopodium urine will have always red sediments. Sarsaparilla will have always white this one. Next, osimum can, agonizing pain. The patient twists about and screams and shouts. Red urine with brick dust like sediments. All these things you will see in the pathological report only. And Berberis vulgaris is the main medicine here. In mother tincture, we have to give in a long run daily 10 drops to 15 drops depending upon the severity of the patient. If Berberis violent sticky pain into the bladder extending from kidneys to urethra. When pain is there, along with Berberis vulgaris, you can give Diascorea. Diascorea is one of the best remedy to reduce immediately the pain. Next, Pereira breva. If berberis power is not sufficient, this Pereira Breva will work. So generally what we will give the continuous years together he is suffering means we will give Pereira Breva, Berberis vulgaris 5 drops, Pereira Breva 5 drops, and Hydrangea is there, one medicine, another medicine. These 5 put together 15 drops daily twice with half a tumbler of water. You have to take more water. By fixing all these Berberis vulgaris, Pereira Breva and Hydrangea, when you are mixing these 3, you have to take plenty of water. For mixing itself, half a tumbler of water you have to take. After that, minimum 1 tumbler of water you have to take. Daily you have to consume minimum 2 liters of water. Then only the stone will move and it will melt also. Next, Cantharis, great burning and tenesmus in the bladder while passing, during passing, and at the end of the passing also. Burning sensation, pain is there means along with epismel, Cantharis will work excellently. Next, Sarsaparilla, when there is white sediments, much pain at the end of the urination. And another thing, another best remedy is Urtica urens. Stones in the Urtica urens. Stones in the kidney, urine is thick. Sometimes it expels some sandy particles, light sandy particles. And natrum pass, after treatment is over, you have to give natrum pass 6x continuously, minimum 1 month, twice a day, 4 pills. That prevents the formation of calculi. Because certain people, when treatment is over, you should not stop it. You have to ask that person to take some German medicine as Regweg or Adel, whatever it may be. So many companies are, they take natrum fast 6x for 4 tablets morning, 4 tablets evening, minimum 1 month. So it will stop to forming of further stones. Another thing, we should not forget this one. There are certain medicines are there, Cordus Mariana, Chelidonium, where when the liver is also along with that, and Chenopodium and Cyananthus. These 4 remedies also important. These 4 remedies I am giving to you as a homework. Next week I will ask. In this urinary problem, preferably bladder problems, in that too, what we call the renal calculi, how Cordus Mariana will work, because it is most important, Cordus Mariana, and how Chelidonium will work, how Chenopodium will work, and how Cyananthus will work. These 4 medicines I am giving homework to you. I will ask by name. Name means your name, not medicine name. So next week I will ask that one. These 4 remedies, take it as a homework. Because I think more than 6 months homework we are not doing. So this time we will give some homework. So with
sir,
this,
can you repeat, sir? Can you repeat?
Cordus Mariana, Cordus,
Okay.
C-A-R-D-U.
Yeah,
C-A-R-D-U, yes, Cordus Mariana, Chelidonium,
Yes, sir.
Chenopodium,
Yeah,
Cyananthus, C-H-I-N-A-N-T-H-U-S, C-H-I, Cyananthus. That is another drug is called Cyananthus, C-E-A. No, not that one. C-H-I-O-N-A-N-T-H-U-S, Cyananthus. These 4 remedies more important for the kidney, bladder, ureter and everything, because you must remember this one. Generally these medicines we are not touched all these days. So you have to prepare this one. I have to learn from you. Okay, with this my lecture is over. Sir Anup sir,
Thank
you can
sir.
give Suresh
Thank
Kumar.
sir.
You can give
Suresh sir has
Kumar.
come,
Ah.
so we will call him, invite him.
Suresh sir. Yes.
Yeah.
He is there.
Anup is audible to all.
Yeah, it's audible, sir.
Audible. Okay, fine.
Go ahead, sir.
Okay. A warm good evening to all the members in the group. We'll continue with the subject organ chapter, and we are looking after the topic that is the different sciences or different pathis, different type of therapeutic methods that were given in the organ. So we discussed the 2 types of system science, that is antipathy. What is antipathy? We saw it. and what is isopathy also. This two system of medicine, we saw it, but of course these two system of medicines have been abandoned or not in practice. They, with the time they have edged away, and now the other systems are, which are homeopathy, allopathy, other things are popular. So we'll take up the next system of medicine, which was discussed by Dr. Hahnemann in Oregon, and that is a system which is known as allopathy. So allopathy is very popular. We all have been using it. We have been day-to-day life is been under the umbrella of allopathy also. So what is that? We'll see some of the merits and demerits also of this system. Let's go into it. So allopathy means it is otherwise known as term known as heteropathy. It is also defined as by the term heteropathy. Allos means dissimilar, or other term used for the allos is heterogeneous. The term used is dissimilar or heterogeneous. And pathos means, we all of us know, it is known as sufferings or the disease. So allos means dissimilar and pathos means suffering or disease. So this science was the name of this science, I want to say the name for this science, allopathy, was given by Dr. Hahnemann himself. So we must remember that his name was given by Dr. Hahnemann. Here in this system, in allopathic system, there is no direct relationship between the remedy, that is drug, and the disease. That is very important, we have to keep in our mind. There is no direct relationship between the drug, medicine, and the disease. Between them there is no relationship. The relationship between the medicinal symptoms and the disease symptom is neither opposite or similar, but quite dissimilar and heterogeneous. I repeat, the relationship between the medicinal symptoms as well as the disease system is neither the opposite, neither it is similar, but it is quite dissimilar and heterogeneous. So there is no direct relationship between the medicine and the disease. This is a very important aspect of the allopathy. Next, the important aspect of allopathic system, it is not based on fixed principles. It do not have a fixed principle. Empiricism and opportunism are the fundamental principle. Empiricism means the physician's experience, data analysis, and various sorts of reports. These are known as empiricism. So empiricism and opportunism is the underlying principle of the allopathic system. It has no inventor. We saw in antipathy and then isopathy, there was a founder, inventor was there. Here in this allopathic system, there is no founder or no inventor of this system. It applies many principles. This system, allopathy, applies many principles of other sciences according to the requirement of the given case. This allopathic science adopts principles of other sciences as per the requirement in the given cases. It treats the disease, allopathy treats the disease by the names or by the names and their common symptoms also. The symptoms of these medicines employed has no actual pathological relationship with the symptoms of the disease. It believes the allopathic system believes in specific treatment, which means considering considering the few main general symptoms of the patient, giving a particular name to that name of the disease, and applying the specific medicine for that particular disease or the diagnosis. So allopathic system basically depends on the specific treatment, considering the few main general symptoms and naming it with a disease name. It applies drug of unknown origin, unknown qualities, and drugs which have never been tested and proven on human beings. And usually, by and large, in this system of science, the medicines are proven on lower animals. That is also one of the greatest what's called disadvantage, we can say, or the demerits of this system, that drugs are of unknown qualities and they have been never tested on the human beings. They are never proven. I mean to say, they are never proven on the human beings. They are mostly tested on the lower animals only. And next, the allopathy system uses large quantity of the medicines. They use large quantities of the drugs, that is in the crude form also. Crude drugs are used here because they because they believe that material substance is the cause of the disease. The basic underlying understanding is that the cause of disease is because the material substance present in the organism. So that's why they use a large quantity of the crude drugs. And they consider, the allopathic system considers the material body to be the object of the sickness, and hence the treatment applies all sorts of drugs also applied in the system. And further, more importance is given here to the pathological aspect of the organism. So this system uses a large quantity of crude drugs, and they believe that the material substances are the cause for the underlying diseases. And also the consideration is for the material body to be the object of sickness. Material body to be the object of the sickness here. So these are the all important aspects of the allopathic system. So having known about this brief about this allopathic system, let's go into little bit detail into demerits. That is more advantage, because merits are very little, demerits are more, as Dr. Hahnemann has given in his organ of medicine. So let's go to first demerits, and then we go to the merits of this science. So first demerit, we'll discuss that it applies many drugs. It applies many drugs separately, or their mixtures are combined together at a time, and sometimes they use one drug for one main each symptom, and the system cannot cure the disease because it is against the natural law of cure. So this is very important. Here I said they use multiple drugs, and they use mixture of the drugs, and they also use one drug for each type of symptoms. So this is against the principle of natural law of cure. So this is one of the greatest demerits of this science. Next, Dr. Hahnemann says that this system is only palliates or suppresses the disease and complicates further. In the opinion of Dr. Hahnemann, or also we also finding these days that the system is only a palliative, and if we treat for a longer period, or treatment is wrong, then it suppresses the disease and more complications are induced in the organism. By hundreds of external applications in the system, particularly ointments, etc., which is practiced in the system, the disease is more driven deeper and deeper into the organism. It is taken, disease is driven inside the organism of the, that is human body, and thus ultimately when the disease is driven deeper into the system, then it affects the vital organ and it affects the more important parts of the body. So this is also one of the hazards or demerits of the system. Besides this, by the disappearance of the external manifestation, whatever external manifestation of the disease is available, disappearing it temporarily, disappearing the symptoms of the disease externally temporarily, the treatment of the disease also becomes very complicated, because the disease affects a vital organ and produces the organic changes in the tissues, and organ which are usually incurable and becomes more incurable in nature. So whatever the disease which appears externally by external applications in the system, they are driven deeper into the system, and by driving the disease force deeper into the system, they damage the internal tissues, and ultimately the more vital organs, they are victimized, they are the sufferer, they are more prone to the disease, and they become, these vital organs becomes incurable in nature. So, and ultimately the disease also becomes incurable. So this is also very important aspect of this demerit of the system, allopathic system. So it ultimately what we want to conclude, that the allopathic system palliates, it suppresses the disease and makes the disease more complicated, more complex in nature. So this is also one of the demerits in the system. Then, as already said, the another demerit in the system is crude drugs. Large crude material substances are being used in the system, and ultimately it brings damage to the patient. This is also one of the greatest demerits of the system. Then the system is very injurious and harmful system, because after long or prolonged medications, prolonged line of treatment, patients suffer from drug disease also. And though it gives sometimes this system gives immediate palliation, but if we treat in a prolonged way, particularly in case of chronic diseases, when it demands prolonged treatment, continuous treatment, then when we use this system, then it becomes harmful and injurious, and this is not the right approach of the treatment. As per the Dr. Hahnemann says, when we palliate or when we suppress the system, this is not the right way of approach of the therapeutic system. So ultimately disease becomes complex and the patient lands up in the drug disease also. So this is also one of the demerits of the system. So drug disease is also a demerit of the system. Then the another demerit, that it has a very good intensified propaganda system. This allopathic world is running by, basically it is deeply run by the various type of propaganda system. So this propaganda system is through media and other things, which is made very fascinating to common people and common mass and people with the common senses. So this makes more fascinating, system is more attractive because it is palliative. The system gives instant relief, it's palliative in nature, That's why it is more attractive to the people, and intense propaganda also becomes one of the demerits of the system. Then other important aspect when we compare with the homeopathic system. Here in this system, no individualization approach or the individualization principle is made or approach towards is done towards a patient. So we have taken the individualization chapter in the previous class. In homeopathy strictly believes in individualization process, whereas in allopathic system there is no individualization concept or principle. So this is also one of the demerits of this allopathic system. Then it only this system only treatment is given part by part, parts, particular organ, particular segment, or particular symptoms also. Okay, there is no holistic approach is done. The treatment is located or considered towards a particular part, particular organ, particular what's called a group of symptoms only. Not a holistic entire body is not considered. So holistic approach is absent here. So this in our system we consider from head to toe. Total human being or total organism is being considered for evaluation. But in this system, this is not so. So only this specific organ or specific type of issue problem is only being focused, is only being considered. So this is also one of the drawback or one of the demerits of the allopathic system. Then chronic diseases cannot be treated very much here in this system. This side, the chronic disease cannot be treated very well here. So more particularly chronic disease when they treat, they complicate more it and they make it more complex. So used by them that they use
I lost your network.
to take the knife. We try to cure the disease through our what is called holistic approach, non-invasive approach. That is more important. So, and our deaths are being least harmful. Whereas in allopathic system, I said the category the synthetics, analgesics, hallucinogens, then various kinds of sedative group of drugs. They all make the person more complex in the future date, or rather the disease becomes more complex in nature. So these are the great demerits of this allopathic system. So I have given various demerits of the system, and I will finally I'll give us what are the brief advantages of this system. Only few advantages that this system is more suitable for emergency like cases, emergency like situations. In acute emergencies, the allopathic science can provide a great sigh of relief, a great deal of relief. to the suffering patient. That is very much positive aspect of this, that in acute emergency, this system becomes very handy, very helpful. Then in recent times, last 30-40 years, use of antibiotics. The antibiotics have saved countless human lives. In the past, the antibiotics have saved countless human lives, no doubt about it. Definitely it has done remarkable cure in the field of the disease, these antibiotics, but antibiotics have got its own negativities, it has got its own dangers, and the most important that over a constant use of these antibiotics over a period of time, we develop antibiotic resistance. That is very, very important to note down. That is, the man develops over a period of time the antibiotic resistance is developed by the body. So what happens after some time, when we use the same antibiotic for cure of disease, then the physician encounters the failure. So we have seen that in 60s, the penicillin, the market has come, the penicillin, and from penicillin we have started we went to amoxicillin. From amoxicillin it went to now today we are using ciprofloxacin. We have come to the stage of ciprofloxacin now. So many of the antibiotics have become redundant, they are not usable, they are not used by the physician. Now every time a new antibiotic has to be devised, a new antibiotic has to be floated in the market, so to treat the disease. So this is also one of the, of course, the positive aspect, but is the negative aspect is also there in this. So the man develops the antibiotic resistance over a period of time. So this is also danger. So then another aspect of antibiotic that is about the allopathic science is it is more rapidly accepted by the health insurance companies. That is very, because nowadays a lot of people take health insurance, and these health insurance companies, they consider only treatment taken in the allopathic science or taken in a corporate hospital, but these insurance companies, they don't consider the treatment at the homeopathic science or the Siddha or Ayurveda. Recently I have come so many cases recently where the treatment has been successfully done by homeopathic hospitals, Ayurvedic hospitals, but the insurance company did not pay the cover amount, their cover. So this is also becomes a difficulty in the growth of the other science. So I have given some of the advantage of this science, but considering the advantage of this merits of this allopathic science, it has got a larger demerits only. So the demerits outweighs the merits. So so these are I have listed the demerits and merits of the system. So in all aspects, when we consider, allopathy is more suitable in case of acute emergencies, but when comes for a permanent cure, permanent what is called treatment, holistic treatment, then this system is not good, and this proves this allopathic system is not healthy, not adaptable by the people who wants to have a permanent cure. Because in our clinical practice, particularly when we see many cases, seen many cases of which have been made more complex, more incurable when successfully cured by our homeopathic science. So it has, I can say that I can vouch for that allopathic system has got a larger demerits than the merits. So with this, given fairly the input about the allopathic science, what is allopathic science, and their underlying principle. They don't have any principle as such, and their merits and demerits. So, with this, we'll go into the comparison between the homeopathy and allopathy. We'll take comparison between the two one by one in various aspects, so that there is more clarity of the picture. Is that more differentiation is done very clearly. So first point, when we'll take up the allopathy at one and others, then I can discuss parallelly with the homeopathic science also. First, allos means dissimilar, pathos means suffering or disease. Point number one. In homeopathy, homeos means similar, pathos means again suffering or the disease. This is the point number one. Point number two, axiom. With reference to axiom, the allopathic science do not have any principle, no fixed principle. Whereas in homeopathy, we have a fixed principle, that is similia, similibus, curanter, like cures alike. So this is the difference between the two with reference to axiom, that is underlying principle. Point number three, it has no direct relationship as far as the allopathic science is concerned. There is no direct relationship between the disease and the drug. Also, the relationship between the medicinal symptom and the drug disease or disease symptom. Medicinal symptom and disease symptom is neither opposite or neither they are similar. They are quite dissimilar and heterogeneous. Whereas in homeopathy, in this our science, homeopathy system of medicine, method of medicines which produce similar symptoms are similar to the disease symptom are being applied here in the patient. So this is the difference between the two. Then coming to founder, in allopathic system, it has no particular founder or inventor. It is purely on empirical methods. It has been based on empirical methods, whereas in our system homeopathy, it is founded by Dr. Hahnemann, and it is, though this law of cure was well known since ancient time, but it was established as a science of healing by Dr. Hahnemann. So law of similars were well known to the medicinal science, our scientific people, since before the time of the Hahnemann, but as a scientific form of cure, Dr. Hahnemann has established as a law of cure. So this is the difference between the two. Then fifth point with reference to allopathic system is there is no fixed principle to guide the physician. Sometimes it's antipathy, sometimes it is heteropathy, usually depend upon the personal opinion of the physician from the individual whims and fancies. Whereas in our homeopathic science, it has a fixed principle, and the guiding factor is deduced from observations from the natural phenomena of the disease, which is true for all scientific laws, that is laws of similia similibus curanter. So in allopathy, they use different modes, heteropathy, antipathy, and they follow the different principle, whereas in our system we follow only similia similibus curanter. Okay. Next important point with reference to allopathy is the disease is regarded as a separate entity, irrespective of sufferer. The disease is regarded as a separate entity, irrespective of the sufferer, as described in the different nosological heads or different nosological terms. So here in our system, disease is never conceived as an entity without suffering of the patient. That is very important. Disease is never conceived as a different entity without the suffering of the patient. And the textbooks, our textbooks features the disease together with the patient's picture. And they, our patient's own picture compose the disease as a whole. So total picture of disease is taken and composed in our textbook, not on the nosological terms. So this is the basic difference between the allopathic science and the homeopathic science. The next point, very important point, in allopathic science, the treatment is done on the generalization plane, whereby all patients belonging to particular nosological head, for example, cholera, pneumonia, all receive the same treatment. So generalization is the principle, is the underlying principle here. Whereas in our system, the individualization is a plane for considering the case, and whereby each patient is differentiated, and in our system, one cholera is different from other cholera, one pneumonia is different from other pneumonia, and prescription is based on the individual patient only. So here in allopathic science, generalization is the underlying phenomena, whereas in our system, individualization is the main criteria of evaluation. Next important point with reference to allopathic science is, to an allopath, the disease process is always start in one or more tissues or organs with structural alterations, followed by symptoms arising of these pathological changes. So the allopathic doctors, they believe that there is a tissue change, organic change is occurring, alterations are because of this structural changes arising of this, and that's why the pathological indications are externally reflected. This is the concept. So, and they observe pathological changes just like in jaundice, in ascites, just like jaundice in case of cirrhosis and ascites in case of nephritis. So they always been guided by the pathological indications internally. But in our system, in our science, disease is supposed to have a commencement from a very fine qualitative level, from the central life force. So we believe that the disease is emanating or beginning its origin from the central life force, and then it progresses towards the structural changes, and subsequently the tissue changes are involved, and this between this there is a quite a larger interval is there, that is the deviation in the life principle and the deviation in the structural changes. There is an interval between this time, and there is a sufficient event happenings between these changes, that is the changes between the life force and the changes in the vital force and the structural changes. There is a lot of time taken in this and lot of changes occurring between this period, and that is these all events which is progresses from change in vital force to the change in structural changes. We are considering more on non-organic features rather than organic features. So we are more considering the non-organic feature in a patient rather than organic feature in the patient. So that's why our science begins very beginning at the very first instance when the metabolic changes starts. So metabolic changes or the metabolic changeable events are perceived with the change in the vital force. So later on the structural changes advent, and later on the structural changes occur. So this is called anamnesis. Anamnesis means studying the progress of the disease. and we do anamnesis in our system. We don't do diagnosis. Diagnosis is that take the pathological symptoms, take the pathological indications, evaluate on that and prescribe it. But we don't do such way in our science. In our science, we begin the show from the metabolic change, from the day when the vital force deviated or vital force is vitiated. From that day onwards, we start analyzing and evaluating the disease, and we go up to the tissue change or we go to the structural change, which is takes a longer time. So this analysis is known as anamnesis, or anamnesis otherwise known as is called as a study of the history of the patient. Study of the history is also known as a anamnesis. So anamnesis is given more important in our system than diagnosis. So between these two, in allopathic science, diagnosis is more given valuation, whereas in our system, looking into history, looking into the metabolic changes first, looking into the changes in the vital force and their consequences, that is more important. Anamnesis is more important. So this is the difference between the allopathic science and homeopathic science. So I have given so far 7 to 8 points differentiation between this, because the time is now limited. I wind up my session now. We'll see more comparisons in our next class between these two sciences. So we'll go into the more differentiation about this allopathic science and homeopathic science in more vividly, so that how our science is better placed, how our science is valued great in comparison to allopathic science. So only when we do differentiation between these two science, then only we feel elevated, or we will feel more enthusiastic or more elevated. What called, it gives boost actually. The physician gets moral boosting than when we are placed with this type of what's called affirmations and confirmations in our mental level. So that's why this differentiation is very important. So that, and much more important, that whenever when there is a counter, what is called counter is done to the homeopathic physician about the homeopathic science, definitely we can also counter with our positivities in our science. So that from that point of view also, we must be equipped ourselves with differentiation, that our science is better placed. We have got a more what's called, we have also have established practices, established science. So with this, I wind up my session. We'll have a more about the differentiation in our next class. Thank you. Over to Dr. Murthy.
Thank you, sir. Thank you, sir.
Thank you, Suresh sir. Excellent picturization of both the system with comparative merits and demerits. Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you very much.
Any questions?
Sir, I have one question.
Yes, sir.
Our maid gets a fever very frequently and body ache. What is the normal treatment for this?
Arsenic album, baptisia, eupatorium perf.
Because sir?
Eupatorium perf.
Eupatorium, yes.
Eupatorium perf. These three medicines you give for 5 days. It will set right.
Anything?
Any
Hypersol for anything? Nothing?
bioenergy, not necessary. Hypersulfur not necessary.
Only
If fever is more means you can give Belladonna up.
He gets every week fever.
So this you give for 5 to 10, 1 week. It will set right.
Eupatorium.
No, he has shown 3 medicines.
Arsenic album, baptisia and eupatorium
Eupatorium
perf.
perf.
These are the generally 5 to 7 days. Any type of fevers it will reduce. If the temperature is abnormal 102, 103 means, then pyrogenium 200.
Pyrogenium.
1 dose daily for 3 days.
And how about sir biocount 11?
Bio number 11 or 12 is there for fevers. That you
Yes,
can
sir.
give for 15 days after completing
Just
the
to
course.
build up this.
Yes. And you have to build up actually by giving alpha
Yes,
tonic
yes,
or
yes.
5-pos tonic. Because
11 or 12, sir. Or
which one, sir?
anyone biochemistry 11 is okay or 12 is okay?
I don't know. You should see 11 fevers or 12. I think headache.
11 is for
11
fever,
is
sir.
for fevers. 12 is
Yes,
for
sir.
headache.
Yes. So
Because generally after fever,
genome and biocom 11. I think.
yes, after fevers
Govind sir, he
generally
said arsenic album,
Arsenic acid.
bacteria and
bacteria and
eupatorium
Eupatoria
perf.
perf.
Eupatorium perf.
Bacteria.
Generally after
Right.
fever, headache will remain for few days. For that only we will ask them to take 11 and 12 put together.
Right.
Any questions, sir?
Eupatorium purpureum is breakbone fever. Breakbone fever. That is the entire back will be painful.
Yes.
So breakbone fever.
Breakbone fever.
It works on body
And
also.
Bio 11
Yeah.
is a mild drug. It only adds strength to the body,
Yes, sir.
but it will not penetrate more on the fever, particularly septic fever like pyrogenum and bacteria.
Yes.
It will not penetrate. Bio 11 will not penetrate.
Sir, I would like to interfere. Sorry,
Tell me.
Dr. Murthy has given a composite remedies, arsenic album, bacteria and eupatorium purpureum. All the three drugs are very powerful fever remedies, and I have employed this in many occasions, and I will let you know that leave alone the bacteria, our eupatorium purpureum is similar to the what's called Dolo 650 or paracetamol.
Yes.
I can vouch you, I can emphatically vouch you that in many occasions I have never used crocin paracetamol in my house or also in my clinical practices. I have given eupatorium 200, purpureum 200 and brought down the chronic fever also in within few hours of time. So it is, I will say it is equivalent to our Dolo 650 or whatever crocin paracetamol will given by the allopathic doctors. So it is one of the greatest fever remedies, antipyretic. So
Yes.
we wholly depend on this drug, particularly bacteria and eupatorium purpureum.
One more point, sir. This Eupatoria perf is good for the best medicine for chikungunya type of painful
Yes.
fevers.
Yes. Bone
Yes.
pain.
Yes,
Bone
yes.
pains.
Yes,
Yes.
yes, sir. Yes.
It works in malaria also, sir. From malaria or dengue.
Malaria, we have other medicines.
Other-
Read about intermittent fevers.
And I would like to just give the information that Chennai is reeling under viral climate, and those who are in Chennai keep equipped with fever remedies, particularly their in their home. All fever remedies which have been told by Dr. Murthy, let's keep in our armory, so that I have come across a lot of typhoid. I have recently come across a lot of dengue, and recently I have come across chicken pox. So Chennai is having a lot of fever cases reeling here in city. So I advise all Chennai people to equip themselves with a lot of fever remedies so that it is handy to them for their treatment. Thank you.
Thank you.
This
Very
separate
lighter, I just wanted to ask one question to Dr. Suresh Kumar. That any science, it believes in growing, and especially in science, one should be able to break the present law and try to produce a different. We are talking about Hanuman and all that. What is the progress on that? I mean, see, at least I am not agreeable to criticize allopathy at all, because it has been grown so much. Every day there will be change. Every day there will be number of papers, patents, and all that. That you cannot. You cannot ignore that. Just our Dr. Surendra has rightly said, there are something is there we should adopt. Even in
No.
therapy being adopted, we also should do those things. Maybe some good things in the allopathy we should also adopt.
No,
And we are seeing what? No. see, we can also see you taught very well as a subject which is available in the literature. That is fine. But see, which is good, which is bad has to be certified by a third person who is, I mean, away from this homeo and allopathy, isn't it? I mean, just to argument sake, lighter way I'm saying. So I feel there is something more to be done in the homeopathy to establish our goodness, our greatness by the people who are doing research. I mean, in my, I'm not contradicting because whatever you say, it is available in the book and you have faithfully produced it, no doubt about it. I feel as a, I mean, I'm only thinking because the Surendra have given some inputs to us because why they are not adopting physiotherapy. It's really required, the pathology. The Murthy Sahib asks every time pathology. I mean, no homeopathy is asking, but he is developing, he is trying to see that his experience, seeing the, I mean, there's some measures are, see, my BP is today something, I have to measure again, then only I will know whether it's cured or not. Like the pathology test also, it is required to know that where we stand, isn't it? I mean, this is only question, I don't want you to answer that. It's a big answer, you know, because
Needs development.
developing science
Sir.
is important.
Sir, I have some thing to talk about on this. Allopathy actually says once we find we have got something in our body to control it, it is necessary. But to remove it from the root, the other things are only working. For example, my daughter had psoriasis with some complications. She is an officer in Indian Oil. And just to avoid the steroids, we thought, okay, we'll go to the Ayurvedic because somebody nearby told it is very successful in Kerala. In fact, I have come here today for a review. Last year I came again, review I'm here. But she got 90% cured through the Ayurvedic. But as he says, the insurance people are not accepting. He asked all the stories, but finally they said everything is okay. But finally they were telling it is not acceptable. So certain things only the corporate and allopathy can means we should not be pushed when we have some good cure in our homeopathy or other things. All the things should be considered, no. So there are some advantages for controlling and keeping our body under control. Maybe it is necessary, but to remove it from the root, only I feel other signs are better. Just it is my opinion.
Madam,
Yes, you are correct, madam. You are correct. But for insurance purposes, for other purposes, homeopathy is not considered.
That's
They
what I'm
don't.
telling, sir. But not only homeopathy, I'm telling Ayurvedic, 90% they have cured. Nearly for 20 days, more than that, they don't accept here. We stayed here
Yes,
even last year.
yes.
The ex-president came. Now Rahul.
That is why I said you must have a record. You must have a
Yes.
hospital. Homeopathy
Yep.
hospitals you must have. You must create record.
But still, this hospital, actually ex-president had, last year when we were here, she came, Pratibha Patil came. Now recent past, Rahul Gandhi came. All of them are coming and saying because it is a renowned hospital. Still they didn't accept in the insurance, I'm telling. So insurance people are only after the medical that lobby,
Yes,
not
yes.
for other things. That is there. And for keeping our body under control, just allopathy is needed because pathology only will tell, but how far we can under control, and then we have to slowly go to our this medicine or Ayurvedic or Siddha, whatever it may be, to completely remove it and keep our system under normal working system. That is my opinion actually. I am here
Yes.
today, I came 2 days back.
Yes.
Still I am parallelly, I am listening to our class only, even though I thought having come, why should I sit? Then I thought I will also have some detoxing some procedure. I came for my daughter only. Just it's my opinion, just like that I'm telling, sir.
Yes, sorry, sir.
Let me have one minute time for me also. So, Professor sir, what you have said is absolutely true. I don't deny it at all. Okay. So this comparisons what I have taught now is big. This is under the organon. This organon was written some 200 years ago when allopathy was not grown. For that matter, any science was not grown. So only Dr. Hahnemann has made comparison keeping into all the references of that time only. Over a period of time, these changes have occurred. So definitely, we in this present circumstances or the present day, we never ignore any system. We don't what's called abuse or depraise or something. We don't talk about the negativity of any system. For that matter, every system has got its own plus, every system has got own benefits, every system has got its own positivities. So definitely every system must play complementary to each other. What I feel personally, all the systems that's why I feel that the government of India has formed the Ayush department, which takes care of all this other alternative system of medicine now. So what I meant to say that all the systems should play a complementary role to each other. Every system has got its own positivity. Every system has got negatives also. I don't say that homeopathy is all positives only. Homeopathy has also got negativities also, but definitely when we make comparison between the other science, how we are placed in comparison to with the other science. That's what that's what analysis is done through organon. Otherwise, when we talking to the present day scenario, uh, definitely we need thorough knowledge of anatomy. Definitely we need thorough analysis of pathology, physiology, all the things we definitely need. And for that matter, in our BHMS course, as you know, it has made 5.5 years course, which includes all the curriculum. Whatever being taught in allopathic system, everything is being brought into the BHMS course, and the students is giving fair input about the everything there. So the today what I try to emphasize that how we are placed better in comparison to uh, allopathy, leave alone the what's called other aspects of the comparisons. Okay,
Yeah.
okay. I hope I try to convince you all.
Yeah,
Time is,
one word, sir.
time is
One word,
over,
sir.
sir. Time is over.
Yeah, we can, 1 minute, sir.
Ah.
So this,
Thank you,
the
thank
problem
you.
is, 1 minute. The problem with this, the treatment of three systems, what we basically follow, the allopathic, homeopathic and Ayurveda, the promotion was given only for allopathic because that is the Western origin, and they were promoting only that, and depriving homeopathy from growing. Even in Hahnemann's time itself, the homeopathy was not allowed to grow. He was chased away from his base area. He has to go. He had to go and live in France and do something. All those things has been like, the allopathic system had been chasing and opposing homeopathy because it was much simpler, and they did not have this cartel. This medical mafia is not able to work in the homeopathic system. So the homeopathy has been deprived of many growth chances, and still we are surviving because that is a simple form of treatment. And even in Ayurveda, there was surgery. Sushruta, the founder of our medical system in India, Sushruta, 5,000 years back, did surgery in human beings. And that was with anesthesia, with different types of herbs, he was able to do surgery. So all these were put under the soil, they covered up, and they promoted allopathy. If that system was there, we would have been much in advanced stage in Ayurveda also. So there is a lot of things behind it. Now, since the time is less, we will stop. Thank you, sir. Thank you for understanding.
Thank you, sir. Thank you.
Thank
We'll
you.
meet next
Thank
class.
you, sir. Thank you. Thank you.
We'll have same discussion on next class. Okay.
Okay.
Thank you, also.
Thank you.
Thank you.
Thank you.
పాజ్ నొక్కాలా స్టాప్ ఇక్కడ పాజ్ ఉంది ఇదేనా ఇది నొక్కాలా